Hello, I am Dr. Bishash. I am a doctor of this heart clinic. May I confirm your name and age, please?
Yes, I'm Mr. Jason Roy, 60 years age.
Okay, Mr. I have got referral letter from the admission unit saying that you had chest pain for 2 hours, and after that you had been admitted into this clinic. Is it right?
Yes, doctor, it's right.
So I am going to talk about your condition, and all the information during our discussion will be remain confidential. So is that okay for you?
Yes, doctor, completely okay.
Can you please tell me in more details what is happening with you?
Well, doctor, actually, in the morning, I was doing some gardening, okay? And actually, suddenly I felt some squeezing chest pain. It's more in the central part. And that didn't actually subside after taking rest. And usually, you know that I had this type of chest pain for quite a long time. So I have some spray, GTN spray in my house. I know that it eases up that pain, but I took that spray, but actually, unfortunately, that pain didn't go away. And actually, I also had some undergo some procedures for my heart condition around 6 weeks back. Okay, so I'm now very much concerned that what actually happened. And actually, finally, I had to go to the hospital and they gave me some pain medication, I think morphine. After taking that medication, I have been quite well now. But I'm very afraid that because the doctor gave me at the time, 6 weeks back, it gave me some blood thinning medication like aspirin and told me that it will be protective for me. But again, I am with the pain. So, what's going on, doctor?
Really sorry to hear that. Can you please tell me that what was the site of your pain? Exactly where did you feel the pain?
Yes, I think it's at the central part of my chest.
And is this pain similar to your heart attack that you had previously?
Yes, I think it's quite similar, doctor. It's quite similar because it's also squeezing one. Okay. And I had some sweating as well. So it's quite similar, doctor. And I had so much fear actually that I thought that I was going to die.
I'm sorry to hear that. And did it start suddenly or gradually?
It actually started quite suddenly, doctor.
And after the procedure, have you had this type of pain ever?
No, doctor. I I had been quite well.
And you said that you feel that pain like squeezing.
Yes.
And after the onset of this pain, was it increasing gradually or remained the same after starting?
Actually, as soon as the pain started, I began to take rest, but actually it didn't improve. It was almost same. Even after taking GTN spray, it was almost same.
Okay. And did this pain go anywhere else?
I think there was some pain in my jaw, I think.
And did you feel any shortness of breath during that time?
No, I didn't feel any.
Any feeling of sickness or nausea?
Yes, I felt nauseated. I know I told you that I had attack some days back, so I know that that pain was completely quite similar to that. I felt some nauseous, sweating, squeezing pain, and also it went to the jaw. However, it didn't go to the arm, but it went to the jaw.
And you also said that this type of pain, along with this pain, you have some excessive sweating.
Yeah, yeah.
Did you feel any racing or pacing of your heart?
No, doctor, I didn't feel any racing pain.
Any type of dizziness?
I cannot specify, doctor. I don't think so.
It's not a problem. Any cough?
No,
Do you have any fever or raised temperature?
no, doctor.
And have you noticed anything that was provoking your pain or making your pain worse, like any positioning?
No, doctor, I couldn't think of any.
And can you tell me that how severe was the pain? If you score from 1 to 10, where 1 is the least pain and 10 is the highest pain.
I think it will be around 6 to 7.
That was quite severe. And you had some procedure 6 weeks ago. After that, are you taking the medications regularly?
Doctor, actually, yes, I'm trying to take those regularly. However, I have some missed doses, I think, but more or less it's been good. I have been trying to take as regular as possible.
In the meantime, have you noticed any problem with your blood clotting?
I don't know of any, doctor.
Any pain in your legs?
No,
Any cough?
no,
Any swelling of your legs?
no, doctor.
Any shortness of breath at night?
No,
Any headache?
no,
Any changes in the vision?
no, doctor.
Any rash anywhere in your body?
No,
Your appetite?
it's quite okay, doctor.
What about your weight?
It's quite okay, doctor.
Okay. And any hot or cold preferences?
No,
Any sweat at night?
no, doctor.
Any lumps or bumps anywhere in your body?
No,
And any weakness at any side of your body?
no.
Have you noticed any, or do you have any other past medical disease that you would like to share?
No, doctor, I have some high blood pressure actually, for which I take Remipil 5 mg, and it's more or less under control. Sometimes sometimes it goes beyond control.
What medication are you taking?
Remipil, I told you.
And do you visit your eye doctor, kidney doctor regularly?
Yes, I visited them 1 year back actually,
Did they
not
say
since then.
anything significant?
Not significant, but I had some eye issues, and they treated me with some laser therapy, I think, and since then it's been quite good.
And do you have any other medical condition?
No, doctor, not that I know.
Are you? Can I see your medication list?
Yes, it's aspirin 300 mg, Remipil 5 mg. That's all.
And why you are not able to take this medications regularly? Is there any issue that I should be aware of?
No, no, I am taking it quite regularly. I have been very less, I think 1 or 2 missed doses in the last 2 to 3 months. Otherwise, it's been okay.
And do you have any allergy to any medication?
Other?
Any allergy to any medication?
No, no, no,
Uh, do you have taken any over-the-counter medication?
no,
Any herbal products?
no,
May I know that any of your family member have this type of symptom?
no, doctor.
Any heart issue in your family?
Yeah, my mother had some heart attack, I think, at around 60 years of age.
Okay. May I ask you a few more personal questions?
Yes, of course.
Do you smoke cigarette?
Uh, I used to, but not now.
Okay. I appreciate that. And do you drink alcohol?
No.
Okay. Do you drive?
Yes, I drive, doctor.
I would recommend you stop driving until you are sure that what is happening with you. Okay.
Okay.
May I know that what do you do for living?
Well, I'm a retired person now, doctor.
Do you need any social support or any support from us?
I'm on my pension. I think it's okay. Okay.
It's fine. Do you want to add anything at this point?
No, doctor, I don't. Actually, I want to know that is it another heart attack? What's this?
Do you feel any pain at your back?
Well, doctor, I don't think so.
Have you noticed any blood or any changes in the stool, any blackening of stool?
No, doctor.
Yeah, at this point, I need to examine you, and then I could give you the best explanation. As I have taken your history and seen the previous medical records, it seems like that you might have another heart attack at this time. It may be related to your previous condition that your blood pressure isn't well controlled, and also you missed some doses, so this can provoke a condition. And also there are some other condition that is having heart attack in the past that can provoke another condition. There are some damage at the heart during the heart attack, so this can again uh, involve some pain that's similar to heart attack. Actually, we need to run a few other tests, like some imaging test of your heart, some other blood
Okay.
test. After that, I can give you the best explanation that what is happening with you.
Okay. Okay.
In the
Okay, doctor.
meantime, we are going to give you these medications, and also we are running this blood test, and we will try to optimize your blood. We will try to optimize your drugs so that you can take them properly.
Okay, doctor. Okay. But well, actually, one thing I have to mention you that since there was some, I think I told you some intervention 6 weeks back. Okay. So they prescribed me some blood thinning medication. Okay. So I'm very afraid to take, and I actually didn't take that, I think. Okay. So is it involved with my symptoms, or will I have to take that blood thinning medication now?
I am sorry to hear that. Actually, the blood thinning medications are very important, and these are actually needed to prevent further attacks. So, as you told that you missed doses and you are not taking doses, to, this can provoke this condition for further attack. And if you are kind enough, then can you please share that why aren't you taking this medication so that we
Yes, doctor. Actually, I go went through the internet, and they told that internet I got that there's a blood thinning medications can cause severe bleeding at times, and also I have some high blood pressure issues. So I am very afraid, and I also read up that aspirin is well enough to control the symptoms. So I didn't want to take this blood thinning medication. I am afraid of bleeding.
Okay, I can understand. Actually, when we give a medication, we always see that is it beneficial or is it harmful. If it is beneficial, then we prescribe that medication. And in your case, our senior doctors or consultant have prescribed you this medication for your benefit. As you couldn't take this medication, but now we are going to assess you in a proper way. And after that, we will give you the advice that what should you take. And if you feel any question, then you always can ask or approach us. We are always here to help you. Time up.
Okay. Okay. So thank you, doctor.
Thank you.
So, well, what do you think is the cause of this kind of chest pain in the patient?
For this gentleman, I think it is a case of another acute myocardial infection that can be due to his not taking anticoagulants or
Mm.
antiplatelets properly. However, this can be a case of recanalization, though unlikely, but also can be a case of stenting failure. So I will
Mm.
consider this is case of Dressler syndrome, though unlikely. And another thing
Mm.
I will also consider that that is previously ruptured uh, muscle can this time is presenting with this type of pain.
Mm. 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 Okay, well, actually, one thing that, can you please tell me how will you investigate?
So, for the gentleman, I will again go for the investigations. That is routine investigations, complete blood count to see anemia and white blood cell counts, then inflammatory markers, ESR and CRP. After that, I will go for the
Mm.
cardiac enzymes if they are elevated or not, and I will go again for ECG and echocardiogram. And, in the
Okay.
meantime, I will also go for the medication list. If there was any warfarin, then I will go for the INR level.
Yeah, yeah, yeah.
And also I go
Okay.
for
And well, if the patient had some racing and pacing, then what would be the main duty of you?
but, post myocardial cardiac arrhythmias that is can be occurred from the ventricular tachyarrhythmia or ventricular fibrillation.
Okay. So this is the main cause, I think, huh? This is the main DD, ventricular tachyarrhythmia. I think after MI, this is very common. Okay, and I think it can cause this type of symptoms, if I'm right. Okay, and yes. So, and how will you manage it? Manage the patient?
Management of these patients is actually multidisciplinary approach. First educating and counseling the patients, then involvement of the cardiologist for optimum drug management,
Mm.
and
Mm.
review for if he needs any further intervention, and then
Yeah.
for his high blood pressure, for
Yeah.
management of his high blood pressure.
Yeah. 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 Okay. Okay. So that's very well done, doctor. Thanks a lot. Okay. Well, actually, for this patient, I think there are some issues that could have been dealt with better. First of all, I told specifically that around 6 weeks back, I had some intervention. Okay. So I think you didn't ask more about that. What happened? What I that was some stent insertion, and after that stent insertion, what medication were given, uh, and have you been taking these medications or not? The patient just uh, completely didn't tell it. Okay, unless in the later part. So that, I think, that was an important part that you missed, I think. Okay, and again, for stent failure, you asked about fever, but I think you could have asked about some nail changes and also some any hematuria, also some any redness in the urine. I think this could have been asked. Okay,
Yeah.
infective endocarditis present or not. And again, for although the fever can also be present in distress, but I think infective endocarditis should have been excluded. And again, since there has been some stent insertion, you told about rashes, but I think you could have specifically asked about if there is any changes in skin in the legs, because cholesterol thromboembolism may be present. Okay,
Yes.
after this stent insertion also, I think so. Okay,
Yes. Yes.
so yes, so these things could have been, I think, evaluated more. And otherwise, this has been a very excellent presentation. I think everything was done well. I think so. And do you want to add anything?
Okay, is this a case of further acute MI or
Yeah, yeah. This is a case of further acute MI. This is a case of further acute MI, but and this was the case of it. Okay, actually, even I first thought that whether there was any tachyarrhythmia present or not, but actually there was no racing and pacing, nothing like that. So it was actually another case of tachyarrhythmia.
so at first I thought
Oh,
that
sorry.
it was a case of Dressler syndrome.
Yeah. This can be you very specifically asked about fever and some and other issues, so that's very plausible that you can think about it. But this
And
was actually a case of the
for
acute.
this patient, stenting failure was due to non-compliance to medication.
Yeah, so this is non-compliance because, but I think infective endocarditis should have been evaluated much more precisely. I think you missed that, and I think cholesterol embolism also, since he hasn't taken those anticoagulants. So I think the cholesterol thromboembolism, that those symptoms I think could have been evaluated also. Although you asked about leg pain or something like that, but specifically I think any rashes in the leg, I think that would have been much better. Any lace-like patterns in the leg, I think this could have been asked, if I'm not wrong. Okay, I think so.
So for stent failure, is there any specific investigations or just
Well,
coronary?
I think involving the heart doctor, and whether any revascularization or any other another angiography is needed or not, it will reside on their jurisprudence, I think.
Okay, thank you.
So I think that's the case. So thank you, doctor. Very well done. Okay.